Time to take a coding break. Howdy, Coding Pros, and welcome back to another episode of the Coding Break podcast with your favorite medical coding coach, Tam Talk, here to talk about all things related to the medical coding industry, and this will include the good, the bad, and the oh-so-ugly details of the industry. So on today's Coding Break, I want to briefly jump on the subject of the government shutdown and how it plays a role in medical coding. So one incident that I noticed last week, I was perusing a payer's website and a pop-up appeared and it stated that there will be a temporary hold on making payments, but the providers or the healthcare organizations are to continue to submit claims, but the claims won't be paid until further notice. So I started scratching my head like, wow, that's weird. So again, it was a federal insurance. So I went down the rabbit hole to research to see what other payers are also placing a hold on claims. And based on my research, and again, I went to my friendly friend, Google AI, to figure out, to give me a quick insight into some of the, insurance companies or information that needed to do the podcast, right? So it stated that as long as the insurance company is like a private insurance carrier, the process is going to be status quo. So what they were doing before the shutdown, they will continue to do it. We shouldn't see any signs of shift or decline in reimbursement. However, we will see some shifting or changes when it comes to our federal payers, such as Medicare and Medicaid, and I will include TRICARE, again, because these are all federal payers. So again, if you are contracted with a private insurance company or just a private insurance, health insurances, then it should be status quo. We really shouldn't see any impact as it relates to how they reimburse claims, healthcare claims. But again, with Medicare, Medicaid, and TRICARE, we will definitely see some sort of shift in how they are reimbursing. And so that also brings me to the topic of just making sure when you submit your claim that you're submitting a clean claim. And what I mean by that is, as it relates to coding, you want to make sure your coding is coded to the highest specificity, such as your ICD-10 codes. And then also you want to make sure it's definitely medically necessary, right? You want to make sure that your provider is providing services based upon medical necessity and not just because, it's a quick reimbursement. You want to make sure the documentation supports the codes that are being submitted to these insurance companies, and you should do that whether we're in like a government shutdown or not. You want to make sure that your coding is pristine, right? Will there be flaws there? Yeah, you may have some flaws here and there, but for the most part, you want to make sure it's not an everyday or a consistent practice where you're submitting, I won't say false claims, that you're being, they're not medically necessary. And if you're unsure, you should make sure you're looking at the national coverage determination or the local coverage determinations set out by these insurance companies to ensure that this is what or the diagnosis of. Excuse me, let me word this correctly. You want to make sure that the diagnoses that are listed on the NCDs or LCDs are what that particular insurance carrier deemed to be medically necessary. Now, we know Medicare is our ultimate go-to, when it comes to certain guidelines. We always reference back to what the government says or what Medicare is saying as it relates to how I won't say how we code, but how claims are to be submitted, right? So you want to make sure that we're following the NCDs or LCDs. Again, NCD represents national coverage determinations and LCD represents local coverage determinations. And many payers do have their own specific policies as it relates to the LCDs and NCDs. And so you want to reference that or peruse that to ensure that when you're coding services that are in the payer is for that particular payer, that you're meeting the medical meeting it for medical necessity. Now, you're not coding to code to the liking of a specific payer. You want to code based on medical necessity. Like, so if a doctor says a patient needs a liver transplant, and you want to make sure that your diagnosis is related to some type of disorder or dysfunction of the liver, and hopefully that dysfunction or disorder is considered medically necessary with that particular insurance plan. So again, you want to make sure you're coding based on documentation and is medically necessary for that particular service that encounter that the patient has experienced. And so again, you want to make sure you're following the protocol for that when it comes to medical necessity. And again, this is what you can do prior to the claim being submitted. Now, let's say the claim is denied, because there are several denial codes that are used. Some are coding related, some are billing related, some are it could just be the specific payer related. And so I won't go into detail what those codes are or denial codes are, but there should be a process in your organization that should help you decipher and how to resolve those denials. Again, some of them may be coding, some of them may not even be coding related, but when it's coding, you want to make sure that you're looking at everything. It's almost like you're doing another audit of the work or the coding that was submitted, and then hopefully you're able to find your issue and resolve it and refile and get the claim reimbursed. But again, there are denial codes that we must that are associated with the denial from the insurance companies, and so it's up to the person who's receiving that claim back to someone in billing to differentiate where it should go, whether it be a coding denial or a payer specific denial or some other denial. Like, it could be like an issue with the patient demographics, but again, that's not a coding issue. Coding is like, again, the diagnosis code, the procedural code, the drug code, whatever it is that that doesn't make sense or the payer deems to be non-medically necessary or it's not covered. Those are things you want to look at. And again, each organization has a process in which they resolve those denials to get the claims reimbursed in the proper process. So again, will the government shutdown affect medical coding? Yes and no. We will see a shift in reimbursement as it relates to the federal payers, again, Medicare, Medicaid, and TRICARE. But as far as like the commercial or private payers, it may be status quo. And this is as of today, the research that I've done. I'm not saying that it will remain the same or it will change. Again, if so, I will keep you up to date on that. But as far as roles, medical coding roles, jobs, I do notice there are more individuals who are coming to the side of medical coding, such as those who have been in a clinical capacity, such as nurses. They're transitioning into a medical coding role. I see people coming from other industries coming into the medical coding role. And I'll do another podcast as it relates to anybody can code, but not everybody's a coder. And but that's for another time. But again, we will see some disruption in reimbursement as it relates to healthcare claims. So as I mentioned, that's what I have up to date. And if anything should change, I will definitely bring it to your attention. But right now, just expect some type of dysfunction. I won't say dysfunction, but changes as it relates to your federal government payers. So that's all that I have for this coding break. And as always, until next time, code on. Toodles.